Dr. James Hawley of Southeast Texas Medical Associates joining us now. Dr. Hawley, we're going to point out that it looks like someone may have said something a little too sassy and you had to put them in their place. Is that not what happened?
I've been married 47 years and she's threatened me and she finally did it.
No.
Really. No, I had to have a little surgery yesterday. I find that when people are looking at something, the best thing is to talk about it. And we get this out of the way. I wasn't in a car wreck. I didn't get in a fist fight. My wife didn't hit me with a 2x4. So we're all fine.
And we're here to talk about something else then
absolutely.
Today.
What I want to talk about today is pre-diabetes.
And that is?
The condition many people have who don't know it. They have a very high risk of developing full-blown diabetes. Remember, we've talked about before, the best way to treat diabetes is don't get it. And so if we can identify through screening those people that are at high risk, and then we can do prevention processes that keep them from developing diabetes.
So a pre-diabetes, is it kind of silly to ask if there are symptoms? There's just a risk factor?
Remember this, there are never any silly questions. Okay. There are only silly answers. A silly answer is that somebody makes up something because they don't know. The best answer if you don't know is say, I don't know. There are no symptoms of pre-diabetes. As it progresses more to diabetes, you may have increased thirst, you could have increased urination, you could have increased appetite without weight gain, but that's unlikely with type 2 diabetes. That's really generally full-blown type 1 diabetes and it's immediate onset. Pre-diabetes is typically unknown. There are millions of people in this country that have diabetes and pre-diabetes that don't know it because they've never been screened. So because we do such an aggressive job treating diabetes at the Joslin Diabetes Center at SETMA, we in fact have a very aggressive pre-diabetes and prevention of diabetes program. There is a test called Hemoglobin A1C. We've talked about that before. It's the amount of sugar that gets attached to your red blood cells in an abnormal way, and it's measured in a number that's expressed as a percent, like 6.8% or 5.2%. And if you have a hemoglobin A1C that's above 6.5%, you have diabetes. If it's between 6.0 and 6.5, you have pre-diabetes. And as it gets closer to 6.5, it changes from one type to another type. We won't talk about that today. But we measured that, and we actually have an algorithm that tells us whether a patient's at high risk, and consequently, we're able to screen them. And once we diagnose them as pre-diabetes, we attempt to get them to do certain things.
To lessen the chance of that happening further?
Absolutely. There are really four elements of pre-diabetes that makes you progress toward diabetes, and two of them are not changeable: your age and your genetics. Can't change that. So we don't focus on that except to say that places you at a higher risk. Two that can be changed are exercise, activity, and your obesity, being overweight. There was a time in this country when people were active. They worked from cane to cane. Couldn't see in the morning, couldn't see at night. My father never exercised a day in his life, but he was always healthy from a weight standpoint and from diabetes because he was busy all the time.
And being active.
Exactly.
Now, if someone wants to get a test, if they think maybe they should just do that for their health, can they call SETMA?
They can call SETMA, or they can ask their personal physician that they want to be screened for diabetes, particularly if they have a high risk. They have a first-degree family member, a brother, sister, or a parent or a grandparent that had diabetes. Then that places them at a higher risk. As they get older, they want to be screened. If they're over 50, they should be screened at least once, and then every 2 or 3 years thereafter to make sure they're not developing diabetes. We can treat diabetes effectively, but we've got to know it.
We have to know it, and then you can treat it. Thank you, Dr. Hawley. We certainly hope your eye gets better.
It will.